Hello everyone, I'm Dr. Amit Malik, consultant neuropsychiatrist. Today we will talk about depression, its causes and its symptom. What do we need to know about depression cases? So depression is most common mental health problem worldwide, and it was the earliest mental health problem being recognized as mental health issue. A population study in India reveals that every sixth person is suffering from depression, and out of those, one third patients think of committing suicide, and almost 20% among those attempt suicide once in their lifetime. So you can see how serious this mental health illness is, and how can you recognize someone, you or your loved one, have depression. Depression is a mood disorder. So as the classification reveals, it is a disorder of mood. So most common symptom is depressed mood or sadness. But this sadness is different from day-to-day sadness. Like you have some situation or circumstances and you become sad. But sadness of depression is different from that, and patient can easily differentiate it. Sadness of depression is persistent and pervasive. It remains most of the time and most days of the week for almost more than 2 weeks. Then we classify it as depressive sadness. Moreover, it is not responsive of the circumstances. Normal sadness goes itself as the circumstances improve, but it remains there. So sadness or low mood is the most common symptom of depression. Other more common symptom is loss of energy, low energy. Patient feel very low in energy and gets easily fatigued and tired on doing small amount of work. He feels, I don't have energy to do household chores or normal day-to-day activities. So this is another important cardinal symptom of depression. Other symptom of depression is loss of interest in work. Loss of interest can be in day-to-day activities, like student can lose interest in studies. A working man or woman can lose interest in his work, going to job, and in family and other all activities. So it is sometimes called anhedonia. Loss of interest is called anhedonia, when the patient loses interest in all activities. And how do you recognize it? The patient loses interest in all activities which were enjoyable to him or her, like sports or movies or any activities he or she was enjoying earlier becomes not enjoyable or lose interest in such activities. So these three are cardinal symptoms of depression. Other than these, what can be symptoms of depression? Poor concentration and judgment. Patient cannot concentrate easily. So due to poor concentration, there is difficulty in registering new things, and there can be problem of memory. Lot of young patients who are suffering from depression complains about loss of memory or forgetfulness. So this is the main reasons of forgetfulness in such patients at young age. Other than these, other symptoms of depression are patient can feel pessimistic about most of the things. He have bleak and pessimistic views about self, about his surroundings, family, about the world and the future. Due to these bleak and pessimistic views, patient feels helpless and hopeless. Patient feel he is not worthy of doing anything. I cannot do anything. I'm useless. So these kind of feelings come in patient, and due to these feelings, patient can have thoughts of self-harm or suicidal ideas. Patient can think of ending his or her life. Other than these, sometimes patient develops delusions also. These are called mood congruent delusions, in which patient is well to do, he doesn't have any financial issues, but he thinks he doesn't have anything and he is very poor, and he is very adamant on this. So this thought can go with delusional thought of nihilism, that patient doesn't have anything, everything negative, up to the delusional level. Then we call it a depressive disorder with psychotic symptoms. So to get diagnosed as depressive disorder, these symptoms should persist for at least 2 weeks. If these symptoms are less than that, then it can be due to adjustment disorder with depressive episode, but we need to treat those episodes also. So what can be the causes of depression? Depression causes can be biological, psychological, or social causes. Biological causes are depression can be common in children if their parents had depression. So they can also transmit these genes, and these can represent in children as depression, depends on their life circumstances and their personality and their stress coping skills. Psychological causes are due to loss of an object, or it can be real object, due to death of someone loved one or separation from some loved one. Social causes are childhood experiences, bad childhood experiences, like lack of maternal care, lack of parental care, or maternal separation, alcoholism in parents, and sexual or physical abuse in childhood. So these bad experiences can lead to depression in adult life in children. So these are the common causes and symptoms of depression. If you or someone of your known have these symptoms, so don't suffer alone. Consult a psychiatrist and get help, because depression is completely treatable.